Black women have the highest death rate and the shortest survival rate of any racial or ethnic group in the U.S. when it comes to most cancers. Now, factors contributing to that fact include economic, geographic, lifestyle, and also a history playing a part.
And this evening, we're sharing a history of abuse of black women's bodies that has actually led to mistrust within the African American community and a lack of participation in research studies and clinical trials that could save lives.
We have to acknowledge that there's a reason, there's a historical reason that black women aren't as likely to visit a clinic to sign up for treatments as maybe white women are today.
A window into the past. His purpose, sharing preserved history. Flagler College professor Michael Butler reveals dark truths of stolen consent.
The mistrust of the formal medical establishment has its roots in scientific racism that stretches all the way back to the period of enslavement.
Figures glorified in history for their contributions to medical advancement. Marion Sims, the father of American gynecology.
As a plantation physician in Montgomery, Alabama, he basically had free reign over, we know of at least 13 enslaved girls and women whom he conducted gynecological experiments on.
Medical tests without anesthesia on purchased women.
The types of gynecological experiments he wanted to conduct caused one of the owners to not give consent. So he purchased the slave, who was 13 at the time, and we know that for almost a 4-year period he conducted at least 30 surgeries, gynecological in nature, on this enslaved child.
That there is some reluctance to seek care, both because there is a very valid mistrust of the healthcare system, especially for people of color and women of color in particular.
Working to achieve health equity, family doctor Kelli Tice knows well the cost of past wrongs that have yet to be fully made right.
Black women being used to advance science without having the benefit of developments that have been created as a result of it.
Henrietta lacks her cancer cells, the source of the HeLa cell line, while seeking care for cervical cancer at Johns Hopkins University.
Cells were removed from her cervix that she thought were being used for treatment, but were actually being harvested for medical experimentation purposes.
Her cells played a huge role in medical advancements, the polio vaccine, IVF and AIDS treatments, cloning.
This occurred in 1951. So this is relatively recent in our immediate past. We're 2 generations removed from a black woman going into a hospital with the reputation of Johns Hopkins for treatment related to cancer and having her symptoms kind of ignored and her long-term health ignored for the purpose of testing her cells.
That's not an isolated event in our history.
Dr. Lauren McCullough with the American Cancer Society is helping to lead a research study called Voices of Black Women. For her, the data collected isn't just science, it's personal, as she aims to figure out why women like herself, Black women, are dying at an incredibly high rate of cancer.
Because we know how much value we have in contributing to the healthcare system. We just want to make sure that that value gets back to the community.
No drugs, no interventions. The Voices research study is recruiting 100,000 eligible Black women across 20 states, including Florida and Georgia.
Not doing an intervention. What we are simply asking you to do is to report your day-to-day experiences and your history. It's what we call an observational study because we are just observing a large group of women and trying to better understand how that impacts risk of cancer and other health-related conditions.
Dr. Tice explains the gatekeepers of medicine have not always been a diverse group.
We've been excluded from all of the things that give us the ability to survive cancer.
So being able to help shape policy, creating health care for all, is why she has decided to sign up for the Voices study.
For us to actually contribute to the solutions that we've been excluded from.
When people say, why are we focusing on African American health? Why are we focusing on the health of African American women? Because for years we did not care about the health of African American women. We didn't care about the health of African Americans, period.
And that was our Keitha Nelson reporting. The American Cancer Society is calling on black women from all walks of life to join this movement. Right now, there is a QR code on your screen. It will take you directly to the Voices of Black Women Research Study page. You can visit voices.cancer.org to see if you're eligible to enroll.